Hello friends, this is Miracle Mentor Dr. Amit Gupta, and in this video we are going to talk about the big news, that is the change in the AIIMS PG exam pattern. Around 40 days before the AIIMS May 2019 exam, AIIMS has introduced 7 different types of MCQs, each having their own different scoring scheme. Right, so guys, the rest of the things essentially remain the same. The duration of the exam will be 3 hours, exam will have 200 questions, and the exam will be conducted in a single shift on a single day. So the major change is the introduction of these 7 different MCQs, which we'll be discussing here. Before we start, all the info that will be discussed here is from the AIIMS prospectus for July 2019 session, and the link is also available in the description of this video. I will advise you to go through it once, not just for these changes, but also for the other basic information as well. Right. So guys, this is basically the table from the prospectus that introduces us to the 7 different MCQs and their scoring scheme. So guys, what is the most important point in this table? The most important point, if you ask me, is this guys, this footnote. I will read it for you. Majority of the MCQs for the July 2019 examination shall be of the single best response type. Okay. So the introduction of these MCQs is going to have a much bigger impact for the future examinations, and these MCQs will be introduced in the upcoming May 2019 exam. Okay guys, so the first type of MCQ is the single best answer type, which is a traditional question which has a question with 4 options and we have to choose the single correct answer. Okay, the marking scheme also remains the same, which is +1 for a correct answer and -1/3 for wrong answer, and if we don't attempt, we don't get anything. Okay, so this is all the same. So this is just an example. We have a question, we have 4 options, we have to mark the single correct option. Okay guys, so moving on, this next type is the multiple true false type. So in this MCQ, the MCQ will have a single body with 5 options or 5 statements, and we have to mark each statement as true or false. Okay, each statement individually has to be marked true or false, and thus each statement will be scored individually. And this marking, that is +1/5 for a correct answer and -1/5 for a wrong answer, is for each statement. Right? So the question itself essentially becomes for 1 mark, and each statement carries 1/5 marks. Okay. So the most important thing about these MCQs which we can use, is that so this pattern is basically inspired from PGI. Okay, in PGI we have 5 options and any number of them can be correct, right? And we have to mark only the correct options. Here we have to mark each statement as true or false. So it's basically a quite similar to the PGI pattern. Right. Then this is just an example. Here we have a question body which says about AIIMS PG entrance exam, and we have 5 statements and we have to mark each statement as true or false. Okay, fine. So moving on, the next type is the match the following type. In this question, we are going to have 2 columns. The first column is going to have 4 items, and we have to match these items with the second column. Okay, so the example given in the prospectus, it shows quite clearly that the second column can have more than 4 options. Okay, the second column in the prospectus, it has been shown to have 6 options. So whatever, it can have more than 4 options, right? So we have to, it's not that simple of a matching, but still, because of the presence of these multiple options to be matched, I think this type of MCQs are going to be relatively easier than the other MCQs to attempt. Okay, and the marking scheme here is +1/4 for correct option and -1/4 for incorrect response. So as you can see, the stakes are actually lower in this question. Okay, and remember, you get a correct you get the marks, you get the +1/4 marks only if you match the all the 4 items correctly. There are no marks for partially correct answer. Okay, clear? So this is just an example. we have to match the column A options with the column B options, right? Fine. And we get a +1/4 for correct response, -1/4 for incorrect response. Great. So the next type is the sequential arrangement type. In this question, we are going to have a list of 4 items which have to be arranged according to a sequence that has been asked in the option. So in the prospectus, the example given is the age group for bone tumors. Okay. Other examples can be to arrange the pathologies according to chronicity. Okay. Arrange pathologies according to aggressiveness and so on. Okay. And for this, the marking scheme is the most interesting point. Here you are going to get +1 for correct response and -1 for negative response. Okay. So the thing is that you have to get the entire sequence correct. Okay. You get marks only if the entire sequence is correct. There are no marks for partially correct sequence, and you get a -1 for wrong sequence. Okay. So beware of this thing. This is very high negative marking. You have 100% negative marking here, right? And the thing is, another thing that we can notice out of these different MCQs types is that these MCQs want us to differentiate similar conditions. Okay. So they want us to know how similar pathologies differ. In what aspect do they differ? How do similar bone tumors differ according to age groups, right? So while preparing, it's always a good idea to try and read similar conditions all in one go and try to differentiate them, right? Fine. So an example for this type of MCQ is you are given a list of 4 options for PG entrance exams, and you have to arrange them in the sequence starting from the least number of questions to the maximum number of questions, right? So this is just an example. Okay. Moving on, the next type is the multiple completion type. Okay. So this is quite similar again to the PGI exam pattern. Here you have 4 options, out of which 1 or more may be correct, but you don't have to mark the options, right? You have to answer according to this key that has been given in the prospectus, right? So it will be there in the exam and you have to answer according to this key. Okay. So what I think is, this is a type of PGI question, but an easier version of it, right? Because you don't have to mark each option individually, you have to answer according to this key, right? And for every correct response, you get a +1/4, and wrong response gets you -1/4. Again, the stakes are high here, the stakes are low here, right? So it's 1/4 only, right? So this is just an example. Here we can see A, B and C are correct. So we have to mark just 1 according to this key, right? A, B and C are correct. Great. So moving on. So assertion reason type. So assertion reason questions have been a part of the AIIMS pre-medical test for many years now, right? And now they are going to be introduced into the PG exam as well. So in this question, we have 2 statements, one assertion and one reason, right? And we have to answer according to this key. This is a similar key that is used in PMT exams. Okay. So what we can do is that if there is a statement A and there is a statement B, what we can do in the exam is we can introduce this because between them, right? And we can try to see if the statement B makes sense, right? If we add because between the 2 statements, right? Because the option is both assertion and reasons are correct, and the reason is either the correct explanation or not the correct explanation. The most difficult options are 1 and 2 only, right? The third option is the reason is false, 4th option is assertion is false, and 5th option is both assertion and reason are false. So these are relatively easier to crack. Okay. And here the correct marking, the correct response gets you +1/4 and incorrect response gets you -1/4. So this is just an example. The assertion says that AIIMS is the most sought after institute, right? If you add because here, you can see the statement B gives a good explanation for statement A, because AIIMS has the good infrastructure and the latest technology. Okay, so this is just an example. Okay, moving on to the last type, that is the extended matching questions. So this has a bit of a complicated structure. Here in the question you are going to have a theme, a list of options, a main lead question, and then 2 or more scenarios. Okay, we are going to look at an example in a short while, but the thing is the marking scheme. The marking scheme here is, for every correct response you get +1 divided by number of scenarios, right? So if the number of scenarios is 2, every correct response gives you +1/2, and every incorrect response gives you -1/2. This is for the each alternative, right? Each option, each scenario, right? So if you see, the entire question will be of 1 mark, right? And as the number of scenarios increase, each scenario gets less and less proportion of that 1 mark, right? So the whole question is 1 mark. If there are 2 scenarios, each question becomes of half mark each. Okay, so this is an example. You have a theme, which is, in this example, is the entrance exam. We have a list of options, right? In the prospectus, the example given shows 8 options, right? And then you have a main question, and then you have a big scenario, right? The scenario essentially will have detailed history, right? And all the signs and symptoms and all the info that you need for the diagnosis. Okay, the major thing about this question is the length, right? Is the length of this question, because the time is limited in the exam, and you should be sure that you don't waste too much of your time reading this comprehensive paragraphs. Okay, and try to be quick with these questions. Okay, so finally concluding, the first most important thing that you must remember is the majority of the exam will be single best answer type, traditional type question as far as the May 2019 exam is concerned. Okay, the other 6 other types, new types of MCQs, are the multiple true false type, which are quite inspired from the PGI questions, and we can even practice a bit of PGI questions as well, just to get the feel out of it. Okay, the other is the match the following type, which is a relatively easier type of MCQ, right? Sequential arrangement, beware of the high negative marking here. You have to get the entire sequence correct, only then you get the correct marks. Okay, multiple completion type, again inspired by PGI, but I will say it's a bit easier than PGI, since you have to mark only one option rather than mark each individual option separately. Assertion reason, try to explain the assertion with the help of the second statement and see if it makes sense, right? Extending matching question, beware of the length of the question, try not to spend too much time on these questions. Okay, more importantly guys, do not panic. The change, even if it makes you uncomfortable, right, the change is for everyone, first of all, right? And more importantly, the concepts remain the same. It is just the way of asking questions has changed, but the concepts essentially remain the same, right? And your preparation essentially remains the same, right? And only one thing that you should make sure about this new MCQ types is that you should manage your negative markings and your time in the exam, right? Beware that you don't spend too much time on lengthy questions, right? And have in mind the scoring scheme before you attempt the exam, right? Okay guys, thank you for watching. I hope this video will help to clarify the new pattern of AIIMS. You can always ask your queries to us. We will try to help as much as we can. Thank you guys.